तो जर्नी जो होती है वो कहीं ना कहीं जो कैंसर सर्वाइवर की होती है वो माइंड पे भी रिफ्लेक्ट करती है कि उनका मेंटल पीस, mental health also get reflected by that.
I won't call them patient anymore because they are no longer patients. They have survived their cancer journey and they're starting on a new journey to try and get back to a more healthy and wholesome life.
Namaste everyone and welcome to another episode of Health 360 with Apollo Pune. You have heard those magical words, I love you. Yeah, you guessed it right. Then there are other three words that nobody is prepared for. You have cancer. For millions of people, this word is very fearful and cautionable to their life. So to help us understand better, we have with us a renowned surgical oncologist and high-tech specialist, Dr. Snita Sinukumar. Welcome, ma'am.
Hi, Gunjan.
Thank you for joining us. Ma'am, as this June month is celebrated as National Cancer Survivor Month, so why it is important to celebrate cancer survivorship and their journey?
So, cancer survivorship essentially represents the ongoing challenges that an individual faces after he or she is diagnosed with cancer. Okay. So it doesn't end there.
Yeah.
So by celebrating our survivors, it gives us an opportunity to acknowledge and honor their strength and resilience while they are on this journey. And it also gives us an opportunity to address their ongoing problems after they have completed their treatment. It also gives us a chance to inspire new cancer patients. So definitely it is an important aspect of cancer care. It is an important aspect of awareness that we are acknowledging and honoring our cancer survivors.
Basically, they will be our warriors who have survived their journey.
Absolutely.
Ma'am, with significant advancement in technology, we are seeing the growth of population of survivorship. So from your perspective, what does it mean to the family, the patient who is surviving, and for the healthcare expertise?
It's a very important question. You see, Gunjan, this is a very positive outcome.
Exactly.
This is one of the biggest miracles of medical science with recent advances in technology, personalized care, improvement in surgery, radiation, newer drugs coming in, chemotherapy. We have a lot to offer to our patients. A lot of our patients are getting diagnosed with cancer at early stages, which means that with this kind of personalized care, they are going to live longer. And what does it mean for a patient? It gives a lot of hope. And it also gives an opportunity for a fantastic quality of life after cancer treatment. What it means for healthcare providers, I think it is important for healthcare providers to understand that their involvement with the patient does not simply stop at the end of cancer treatment. And it is our responsibility to help them, guide them and address the challenges and address the ongoing issues that they may face as they are embarking on their lives post-cancer treatment.
Ma'am, as you have said कि they must have facing बहुत सारे challenges in their journey. So there must be some physical challenges, physical health challenges they must be facing. So what are they and how they can cope up with them?
Cancer treatment is definitely not easy.
Exactly.
And it does leave a lot of physical challenges and in a patient who has been treated with cancer and is surviving cancer. So the commonest physical challenges that we see in our patient post-cancer treatment is fatigue. They have a lot of tiredness. Okay. They have, some of them have bone health issues, chronic muscle pain, body pain. Many of them do also have nutritional challenges. Okay. And how do we overcome this? You know, this is a very individualized treatment approach. What is important at the heart of all this is good communication. Good communication between the cancer survivor. I won't call them patient anymore because they are no longer patients. They have survived their cancer journey. Yeah. And they're starting on a new journey to try and get back to a more healthy and wholesome life. So our cancer survivors, how are we able to help them? First thing is by communicating with them, by reaching out to them, by telling them that we are there and it is not just now that the treatment is over and we are out of their lives. No, we have to have that involvement through various rehabilitation processes, depending upon what their need is. So it's a very personalized approach we take to to address the various problems that these cancer survivors might face in their lives onwards.
Ma'am, the journey itself is a very tough journey. बट देयर आर थिंग्स जो माइंड को ज़्यादा करेक्ट कर जाती हैं. तो जर्नी जो होती है वो कहीं ना कहीं जो कैंसर सर्वाइवर की होती है वो माइंड पे भी रिफ्लेक्ट करती है कि उनका मेंटल पीस, मेंटल हेल्थ ऑल्सो गेट रिफ्लेक्टेड बाय दैट. तो हाउ दे सर्वाइव, वो लोग कैसे अपने आप को पूरा मेंटली प्रिपेयर करते होंगे इस जर्नी के लिए?
So a cancer diagnosis and the subsequent treatment does have a very significant impact on the mental and emotional health, not only of the individual diagnosed with cancer, but also the caregiver and the family.
Exactly.
So in such scenario, again, the most important part is communication. Fear, anxiety, apprehension, all these are very, very natural responses. But the most important thing for the individual who has been diagnosed with cancer is to communicate, because there are a lot of avenues with which we can help these patients. We have psychosocial support, we have support groups. The key is effective communication. And that's the only way that we will be able to address this problem. And by effective communication, by constantly encouraging our patients, by telling them that it is just we are here, and it is just a momentary period, and everything will be fine as the days go by. Yes.
Yeah. Well, basically they need to be get communicated very positively so that they can be surviving. उनकी mental health, physical health, दोनों चीजें बहुत ही hand to hand अच्छी जा सकती हैं. मैम, जब एक ट्रीटमेंट कंप्लीट हो जाता है तो पेशेंट को लगता है कि अब क्या हॉस्पिटल बार बार जाना, हो गया एक बार ट्रीटमेंट, अब तो दे कैन सर्वाइव देयर ओन. बट आई थिंक द फॉलो अप, बार बार डॉक्टर से मिलना कि अब उनकी हालत कैसी है, व्हाट दे आर फीलिंग, दैट इज आई थिंक इम्पोर्टेंट. तो फ्रॉम योर पर्सपेक्टिव, हाउ इट इज इम्पोर्टेंट एंड व्हाई इट इज इम्पोर्टेंट फॉर देम, फॉर पर्टिकुलर सर्वाइवर्स?
So again, it's a very important question. Follow-up is very, very essential, and I would like to emphasize here that follow-up is not just about the cancer treatment and the cancer recurrence. Of course, follow-up is needed because it gives us a chance to detect recurrences early, and that is the point where intervention works the best.
Okay.
But apart from early cancer recurrence detection, which is one of the main and most important goals of a systematic, disciplined follow-up of a patient who has undergone cancer treatment, the other aspect is it gives chance to the healthcare provider to monitor their physical, mental, psychological health.
Yeah.
Okay, so it gives us an opportunity to discuss, are there any ongoing physical challenges? Are there any symptoms apart from the cancer diagnosis that is worrying them? And it gives us a chance to address these issues. So until and unless the follow-up happens, until and unless this contact with the cancer survivor and the healthcare provider happens, this aspect of the survivor's journey cannot be touched upon.
Ma'am, as you said one word, that उनका जो आप पूरी जर्नी होती है, you are the part of that. तो एक आपका भी और पेशेंट के साथ जो सर्वाइवर होता है उसके साथ भी अब एक रिलेशन क्रिएट होता है. तो हाउ डू यू डिफाइन दैट?
Yeah, when we are practicing medicine, there are two schools of thought. One thought is that when we are dealing with patients, we have to be very technical and we have to be very, systematic about diagnosis. But I beg to differ. I feel empathy is a very, very important aspect of a doctor's treatment.
Definitely.
And while we are scientific, at the end of the day, we are human beings.
Exactly.
And empathy is very, very important, because a doctor-patient relationship at the end of the day is a human relationship. And building that trust is important. And it is a fact. I have patients who have become very close to me, and I have become very close to them. And we know our roles and we know our boundaries. but at the same time, we enjoy that. We enjoy that relation, we enjoy that chemistry, that they can treat me as a friend, they can confide with me beyond me being a doctor. So that is exactly what is important, and I'm sure many of my healthcare colleagues would probably share the same experience. So especially in cancer treatment, because it is a very, very prolonged treatment. The journey is very prolonged. So and like I said, it goes beyond the diagnosis, beyond the treatment, as they are embarking on a journey, on a life beyond cancer treatment.
Ma'am, as you said, you are the part of that journey. So people must come to you कि मैम मुझसे ये नहीं हो रहा है, कुछ उनकी habits होती होंगी that they can change in their life for the survivorship. So what are the lifestyle habits that you recommend them, or how they can change their habits to survive more?
Yeah, so this is a very important aspect of survivorship, to maintain a healthy lifestyle. Of course, cancer, as you know, is now labeled as a chronic disease, as a lifestyle disease. With changing lifestyle, more and more people are going to be diagnosed with cancer. But with development and advances in modern science, they are going to live longer. But live longer, healthy living longer. And for that, they have to adopt healthy lifestyles. And what are the things that they need to do, which I think each and everyone have to follow. We also follow, and our cancer survivors are no different. So physical activity, exercises, what is suitable for them. So it's not a one shoe fits for all purpose here. What activity is relevant and suitable to them, they must engage in some kind of physical activity. Avoiding tobacco in all forms. Many cancers do develop because of tobacco consumption. And again, there is a specific rehabilitation process for individuals who are addicted to tobacco. So absolutely very, very important for them to not take tobacco post their cancer treatment and diagnosis. Alcohol, yes, avoiding alcohol as much as possible. So these are the two most established carcinogens. Eating healthy means not to follow any food fads. Eating healthy, absolute normal Indian balanced diet, good carbs, proteins, salads, foods that will provide vitamins. Of course, some supplements are required because a lot of changes happen in the person's body once they go through the cancer treatment. So food, along with food, healthy supplements are also required, which is recommended by the healthcare provider, the doctors, and their dietitian team. Apart from that, what is more important is to have a very, very good, sound mental health. They have to have a personal goal, they have to have a purpose, and they have to not worry about the cancer recurrence. So it's literally like a new life, and you have to take it forward with absolute positivity and resilience.
It's very important to have a positive view.
Absolutely.
कि आगे मुझे जाकर जीना है. ये अगर थॉट आप पेशेंट के सर्वाइवर के मन में है, then they can survive to anything. मैम, many of the patients are working. मैंने देखा है कि वो लोग वर्क करते हैं, उसके ट्रीटमेंट के बाद भी वो लोग चाहते हैं कि अपना वर्क वापस से जो पॉज हुआ उसको रीस्टार्ट कर सकें. तो व्हाट इज द हैबिट्स रिगार्डिंग द वर्क लाइफस्टाइल यू सजेस्ट टू देम, कि कैसे वो लोग अपना लाइफ बैलेंस कर सकते हैं वर्क लाइफस्टाइल के साथ?
So, Gunjan, actually every cancer is different, and every cancer treatment imposes a different kind of challenge in the life of the individual who has been diagnosed with cancer. So this is a very broad question, but what I can tell you is that it is very encouraging that most of our patients who have been diagnosed with cancer do go back to their work life. Of course, the entry and the induction is slow, because even we want them to get fully recovered. We want them to get fully confident of themselves. We want them to be confident in their job roles, personal life, home roles. So it is a gradual process. There are challenges, like I told you, there are some physical components that make them more disabled, like fatigue rehta hai, tiredness rehta hai. So they have to navigate through this, which they do it beautifully, but it is a time-bound phenomenon. We can't say that it, immediately after cancer treatment they will go back
to their
work life as it used to be before the diagnosis. Many of them have gone back but it is a very, very individual scenario, and it is a time-bound scenario, but they are successful in adapting to their work environment very, very fast.
Okay. Ma'am, one of the biggest fear that cancer survivor have the word recurrence. They fear the most about that. So how they live with this word कि अब recurrence नहीं होगा और chances उनके पास कैसे कम रहते हैं या कैसे वो लोग खुद को handle कर पाते हैं with this word particular thing fear.
So this is a very, very valid fear or very, very valid problem that every cancer patient faces. They always ask us about recurrences, and it is a very valid concern. So the idea is to not let this fear of recurrence dominate their lives.
Okay.
And as I mentioned, what are the things that they need to do? Maintain a healthy lifestyle, have a positive mental attitude, don't miss the follow-ups. So we constantly keep emphasizing these aspects, and to further emphasize and further support, to further consolidate this positive attitude, we have a lot of other support systems, like we have support groups, we have psychosocial support groups where patients get the opportunity to meet other patients who have undergone the similar kind of treatment and in the similar journey post their treatment. So all these things help to build confidence, help to decrease their mental apprehension about the cancer coming back. But one way to navigate through this is definitely following a healthy lifestyle, doing all the things that are recommended to do, to be very sincere with their follow-ups, to communicate with their healthcare provider.
It's given me immense pleasure to welcome a homemaker, entrepreneur, and beyond all, a breast cancer survivor, Surbhi Mahajan. Welcome, ma'am. We are very thankful that you joined us today.
Thank you, Gunjan, for having me here. It feels truly special to be a part of the National Cancer Survivor Month conversation. Thank you.
Ma'am, as we have mentioned a cancer survivor, can you take us back to the day when you have heard for the first time that you have breast cancer? What was that feel? What was that moment? How you were thinking? And what was going in your mind?
I don't know, Gunjan, if it's actually a coincidence or what.
Okay.
But it's amazing that this podcast is happening on the exact same date, 14th June. 10 years ago, 14th June 2016, I was diagnosed with breast cancer. And yeah, to take you back there, I was shocked. I remember myself being shocked, going totally numb. You know, the words, you have breast cancer or you have cancer, are not something that you ever expect to hear about yourself.
Never.
And when I heard those, I felt the world is over for me. I felt totally shattered. But with whatever courage I could gather at that moment, I looked up at my doctor and I said, "Doctor, I have a 3-year-old son. Will I survive?" And she held my hand and she said, "Of course you will, Surbhi, 100%. And you know, at that moment, they were not just words. They became a promise. They really became a promise for me, and I held on to that promise throughout my journey. And now that I have my doctor here with me today, I really want to thank her. 10 years ago, ma'am, you made a promise to me. And today I'm sitting here, happy, healthy, and celebrating these years. Thank you, ma'am.
I'm extremely proud of you, Surbhi, truly, for all that you are, all that you've become, and all that you have survived.
Thank you.
Ma'am, I have a question with you. As she mentioned to you that she have a 3-year-old son that time. How you have encouraged her? What was your thought on that? Ki kaise she can live with that fear ki she have cancer now and she have a child of 3 years?
It was very simple. I had 2 things to do. I had to make her cancer free. I had to ensure that she's going to go back to her son and be the mother that she is, be the wife that she is. Like I said, the most important thing for a doctor is also to be a doctor, but also to be that human being who is going to hold the patient's hand and have that empathy throughout the journey. So I think it was quite natural. Being the doctor, being scientific, going through the entire treatment, explaining through the treatment, but at the same time instilling that sense of positivity that she is going to be able to be all that she is after this treatment is over.
Ma'am, as you have mentioned, ki this part of journey is very strengthful. You need a strength. So there is some person, there is someone, the source of strength for you. Who was it?
That was my husband. That was definitely my husband. I don't remember that if he really got enough time to, because his life was also changing.
Definitely.
Everything was changing, everything was scary for him also. But I don't think he got enough time to express his fears, express his feelings, or really to talk to somebody, because he had a big task lying ahead for him. And he handled everything very silently, very smoothly, whether it was organizing the finances, insurance, things at home, and playing the role of both mom and dad to that little boy who needed a lot of time and attention. Today my son is 13, it's a different world for him, but that time was really important.
And difficult for him also.
Yeah. And my reason to fight, I want to mention that as well. My reason to fight this disease was my son. I did not want him to face any challenges because of all this. I wanted his life to continue uninterrupted. I wanted to see him grow and, turn into a beautiful human being. All that I had visualized and dreamt for him as a mother, I wanted all that to continue. So that just gave me strength to continue to fight it.
In the whole journey, you must have some part कि जहाँ आपको लगे कि मुझसे नहीं हो रहा है, अब I need to give up this. So is there some point you thought like that कि I need to give up, I can't be this?
I don't know. Sometimes, I would think that maybe I'm abnormal. I've become feelingless because I never had those thoughts that I want to give up. I really never had.
Okay.
And never give up is something that I kept hearing from my father all my life. So it stayed on with me. And I've personally also always believed that, whatever you may be going through, just go on and don't give up, and keep fighting it till your last breath. So I think that was my motto, and belief in God. He's given me all the strength. So see, there were very difficult days. I'm not going to say that okay, it just happened like that. Very, very difficult, uncomfortable moments to me, personally, losing hair, wearing a scarf, and people giving you looks of sympathy, some looking at you with a big question mark, kya hua hai aapko? But I continued. I really continued, and it was my very conscious efforts. I would go to my son's school every day. Whenever there would be a function, I would be there. I would meet friends, go for painting classes to keep myself occupied. So all that helped. All that really helped.
In the bio, I have mentioned, in the introduction, I have mentioned that you are an entrepreneur with the homemaker. So what continue to have that particular workshop कि मुझे काम करना है, no matter what happen, मेरा बेटा है, मेरी family है, I need to be that. Ma'am also told me that you are making some pieces of small candles, beautiful candles. You have gifted her as well. She mentioned me that. So what keeps you motivated for that?
She is the motivation.
Definitely, she is the motivation for everybody.
Yeah.
What I have spoken with her, she mentioned that she had made the journey of the patient, of the survivors, so smooth that they don't think it is a journey of cancer.
Right.
The idea is to have a very positive attitude. And like I mentioned, one of the most important thing is after this, you have to set personal goals. Sometimes the patient doesn't understand that. So as a friend, as a person who's been treating this patient for such a long time, you also understand the patient's nature, the person's character, and the potential. You get close. That's exactly. You just have to give them that nudge and identify that they have that talent. Give them that nudge. So I think that's what happened with Survi.
Yeah, I was having little anxiety. I mean, it was going little high, and then I just met ma'am, and then she said that do something. So I had always been into the creative side, painting and
Okay.
trying small things. And she's like, can you make candles? So I said, I've never done that. I went home and did some course, some short course, and then I just started with it. So I think your mind is what it's all
It's all
about.
about.
It is only and only your mind. Medicines, everything will support you, but that grit
Will.
has to be there.
So that your will was there ki I need to be there for my husband, for my son.
Yeah.
And I think what you have told me about the story, the men in your family, is it your father, your son, or your husband? They have always been your supportive pillar
Yes.
to your journey.
Yeah.
As this month we are also observing a mental health awareness month.
Okay.
So I think these three men in your life has already created and supported your whole
Absolutely.
journey. So what's your feeling regarding them?
See, they have to play the role all around. So they have to support you, they have to look at the finances, house, and maintain that, calm and composure, and
And that
maybe
dignity.
not express also. I mean, that's
Exactly.
also a difficult part to, continue to keep things inside you,
and not to tell anybody.
yeah, and not to cry. And
we person as a person, I used to cry a lot कि थोड़ी सी अगर minority मुझे थोड़ा भी challenge होता है तो I cry a lot. But for them to make you happy, to make you survive that, आपको support करना, everybody in family support that, they have to take a lot of courage to
Yeah.
do that. And I think you also supported him.
Yeah.
कि आपने उनको लाइफ में पूरी जर्नी में सपोर्ट किया कि नहीं, I can do this, your
Yeah.
willpower.
Yeah. I also motivated him with because if I see initially when the news came in, for few days he was quite disturbed. I mean, he was not able to get back to work, and then I motivated him. I said, "अगर मैं handle कर पा रही हूँ, then why can't you?" And
Exactly.
so it's a mutual
understanding
way of handling.
Ma'am, as you have mentioned your story, I get to know something about you. But my audience also want to know, everybody wants to know कि how you have completed your 10 years. What was your journey? एक word सुनने के बाद आपकी life कैसे change हुई and how you have been gone through everything in these 10 years.
So Gunjan, yeah, initially 1 year went in treatment. I did have, as ma'am also mentioned, it's a long treatment. So it went into that. And I think there have been a lot of learnings, and I really want to make a point here because it has shaped my personality, and it has given me a different outlook in life. That when it comes to relationships, we are all very casual about it. We take it for granted.
Yeah, exactly.
And it taught me that value people's time, be kind, and say that you are there. I'm there for you. Sometimes even these small words matter. And a lot of times, if I would talk to family members, everyone or friends, everyone would say that, okay, be positive. And sometimes I would be a little irritated also. Ki yaar, main to positive hi hu, wahi, matlab aur kya? But that's the only way of going about it. We all feel that जब भी we are in a problem, we think that my problem is the biggest. जो मैं face कर रही हूँ, nobody can understand that. But this journey has refined my personality. It has taught me to look beyond my struggles and to understand that there is always someone, who's having who's fighting a bigger battle. So it teaches you a lot of gratitude and how you should be grateful, how you should find joy in small things and listen to your body. I was very casual about it, okay. But yeah, be health conscious, go for fitness. I do Zumba. I've been doing Zumba for past 5 years. I enjoy that. So I go for a walk daily. So these are ways to maintain fitness. And mentally, yes, the journey, you have to figure out your own ways. So I did that, okay, candle making. I initially started with something into skincare, so homemade soaps and those kind of things. I love to teach, so would spend a lot of time
In teaching.
doing, teaching my son, and so it's been nice. It's been an evolving journey in the last 10 years.
Okay.
And,
So, I have a question that if you could tell one thing to your that 10-year-old person who have heard for the first time that you have a breast cancer, how you have treated her and what will be the thought or what will be the thing you should have told her, your old 10-year.
I don't know if it's really possible to get back to that personality, but yes. So the first thing I would tell her is that take a deep breath, and this diagnosis is not the end of your story, right? And have faith in God. Doctors, you have the best doctor, and family, friends, they will not let you walk this path alone. You are loved and you are valued, and believe in yourself, and you're going to be okay. And I promise you that today. I'm going to tell her that. And also, one day, I would say that, one day you would look back and you would be proud of yourself. Today, all these fears and this pain, one day it will become your achievement.
Your strength.
And that day is when you will be grateful that you never gave up.
Exactly.
Yeah.
Your journey is a wholesome journey. That the word gave up thing already is a big statement. That you never gave up is a perfect but a beautiful word. You have struggled a lot, your strength, your beautiful journey, your relationships helped you a lot in surviving this relationship. That one word is coming all over and again, survivor. So for everybody the survivor word is different. For you I think it's meant different, for you it's different. So I need to know, and everybody wants to know what for you survivor meant and how you think for that.
So survivorship is not a label.
Yeah.
It's a perspective,
Exactly.
right? It is not just about being cancer free. It's a journey. It's being able to look back at one of the darkest chapters of your life and say with confidence that I
Yes, sir.
fought it boldly and I grew through it and I'm still here. To me, survivorship was not a destination that I reached alone.
Yeah.
Yeah. It is something that came as a group. My journey on survivorship, I would say, was a collective effort. So
Exactly.
this achievement, I would say that, okay, I'm a survivor sitting alone here, but this achievement belongs to everyone who was a part of my journey, who walked with me on this path. So that is what it means to me. And as survivors, I think we are living proofs that there is life beyond cancer. And the brighter days are always ahead. You just have to have little patience and they'll come.
For you, survivorship.
So, as a healthcare professional, as a doctor, for me, survivorship is not the end of the road, but it is actually the light at the end of the tunnel. So, most doctors would feel a sense of accomplishment when they would have treated the cancer, and your patient walks, and you are able to tell that the patient is cancer free, you are cancer free now. That would give the doctor a sense of accomplishment. But for me, being a part of my patient's journey beyond the cancer treatment, that is the most gratifying aspect. And that exactly what survivorship means to me, that I have not stopped being in touch with my patients after their cancer treatment. I have been given the opportunity to help them or be a part of their journey as they are trying to live their lives healthily, more physically better, and with an improved quality of life. So that is exactly what survivorship means to me.
Perfect. For everybody, survivorship is different. Ma'am, as we are in the end of this conversation, so I want to have a final message for the patients, for the survivors, for their families. One last message for us.
Thank you, Gunjan. It was a very wonderful experience, and it is one of the subjects which is very dear to my heart. Cancer survivorship, cancer support group. So, what I would like to tell is that cancer survivorship is exactly that, a testament to the human resilience and also a testament to the miracles of modern science, because it is because of this advancement and also because of the human resilience that we are seeing more and more patients living with cancer, living cancer free. And it is also a sense of immense hope and positivity to all the family members. It cannot be done alone. It is done with the support of friends, family, and also the healthcare professionals.
Yeah.
To the healthcare professionals, I would like to emphasize that it is our responsibility to help our patients who have successfully conquered this illness, help them, hold their hands, work with them so that they are able to live more healthy, fulfilling lives onwards and upwards.
Like today's conversation has made me clear and basically to us that cancer is not just a medical journey. It's a journey of
Absolute
hope
life.
and courage. So I am very thankful, and even we are very thankful to both of us that you have told us and tell us कि क्या कैसी journey होती है and what person goes through that and how beautiful the journey is beyond the life of treatment. Thank you so much for joining me today. Thank you.
Thank you.
Thank you.